Greetings and a warm welcome, everyone. I am Asya, the assigned moderator from Clirnet. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us from across the country and also to our wonderful global audience. We are indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us today. Allow me a moment to introduce our platform, Clirnet, to you. It proudly stands as one of the largest live digital continuing medical education platforms in India, providing a space for doctors to create and share medical content. Now, I would like to extend a special welcome to today's distinguished speaker, Professor Dr. A.L.Meenakshi Sundaram, sir, who is a distinguished anesthesiologist with an illustrious career in medical education and leadership. He has served as the Dean and Director of the Medical Education at several leading government medical colleges, including Theni and the renowned Stanley Medical College, Chennai. With decades of academic and clinical excellence, Dr. Sundaram has also contributed significantly to the Indian Society of Anesthesiologists, serving as its vice president in 2016, National Governing Council member, president of the Tamil Nadu State Branch, and state secretary in earlier years. Currently, he continues to shape future generations as a professor of anesthesiology at Thanjavur and Tirunelveli medical colleges, while also being recognized for his leadership, mentorship, and dedication to advancing the field of anesthesiology. The topic of today's session is Magic of Communication Skills for Doctors. I would like to give you an overview of today's topic before we start the session. The magic of communication skills for doctors lies in building trust, enhancing patient satisfaction, and improving clinical outcomes. Effective communication involves active listening, empathy, and clarity when explaining diagnosis, treatment options, and prognosis. It enables doctors to gather accurate histories, address patient concerns, and foster shared decision making. Non-verbal cues such as eye contact and body language play a vital role in reinforcing understanding and compassion. So, without any further delay, I would like to hand over this session to Professor Dr. A.L.Meenakshi Sundaram, sir, to share his insights. Kindly proceed with your talk, sir. Over to you.
Thank you very much.
Yes, sir, your slides are visible.
Thank you very much, Clirnet, for having me, given me this wonderful opportunity of talking to the global audience. The magic of communication skills. I cannot explain everything within 1 hour. Probably I may take 45 minutes, leaving the 15 minutes for discussion. And Clirnet, you have given the outline of the communication skills. So I will take the cue from that and I will proceed with my lecture. So the magic of communication skills definitely reduces the workspace violence in the hospitals. So the doctors need to know how to communicate with the patient and mainly the attenders. So why the communication is important? Because the communication, it is important for expressing information, behavior, what I feel, what I know. It has to be informed to the others. Even in Tamil, the ancient couplet written by Saint Thiruvalluvar 2000 years ago, it says a person who could not communicate with others, he is just like a flower without a fragrance. So we have to behave like flowers with fragrance, and for that fragrance, the communication is important. So it helps to understand and respond to the other's feeling. Even it can be by way of words or it can be by touch. In communication, even a small slip costs heavy. Now, I will give you an example why you are not supposed to slip in the communication. See, it is a written communication. It is mentioned free internet and Wi-Fi available. It has been written as Wi-Fi available. So it conveys a very wrong meaning and it will cost very heavy. And even if your communication is right, sometimes it may give a wrong meaning. Like this. See, buy 3, get 1 free is for clothings. But here, just because the people are standing over there, even if it is right statement, it can convey a different meaning. This is an important part of communication, right? See, another example is food safety first means you have to be concerned with the safety mechanisms in the food preparations. But here, taking a cue from the food safety first, they have decided the goat is a food and they are wearing the helmet for the goat, and these people are traveling. So, this sort of a miscommunication should be avoided, especially in the patient doctor relationship, right? You may think the doctor is not good at communication. So he can ask his subordinate to communicate. Who is a good communicator? He can, just like a surrogate mother, a surrogate communicator could be appointed. It is not possible because the patients like to listen only from the doctor. So the subordinate communication will not be accepted by the attendants and the patients. And even it can happen like this. Instead of Foley's catheter, the nurse may write as a Foley's catheter. And here you see the ultrasound abdomen and pelvis, AP lateral, they have written. So this sort of a miscommunication will spoil the reputation of the physician. So what I want to convey, communication is a dynamic process. See, this means we convey a thought, a feeling to someone. Listening is also a part of the communication. So how it is received depends upon the set of events. That is what I am going to talk today. So how you say, what you say plays an important role in communication. So in communication, everyone knows the first thing is verbal communication. That is by words, by speech. So the verbal communication is use of words, numbers, and symbols. See, in the verbal communication, the tone, pitch, the pass which we give, it gives important information to the patient and the attenders. And if you want to capture the attention of the audience, then the tone modulation is to be there, pitch modulation is to be there, and the rate of speech carries more weight than the words. So more than the words, you concentrate on this tone, pitch, and quality, because this tone and the pitch convey the emotions. So you can forget about the words, but the way in which you modulate, the attendants think that the doctor is empathetic to them. So if I say verbal communication, there is a non-verbal communication automatically comes in. So the non-verbal communication is by facial expressions. So you should always have a smiling face, even though it is very difficult when the attenders and the patients are arrogant. But anyway, as physicians, we have to have our facial expressions in a pleasant way. And even that moderator mentioned eye contact. The eye contact is a must. So whenever you talk to the people, mainly the patient and the attendants, mainly maintain the eye contact and the gestures, then body language. These are all the non-verbal communication, but non-verbal communication plays an important role in the communication part. So the proximity and the touch should be a consoling touch, gentle touch. Then that will give a lot of information to the patient and the attendants. And we have to remember, most of our communication is non-verbal. That is by body gestures, facial expressions. So mostly it is non-verbal, which is missing in emails and tweets. That is the reason why in this social media, the emoticons can have come. So, but even if you put a smiley, it cannot replace a smiling face. So the facial expressions are important in communication. They play an important role in non-verbal communication. So these are all some facial expressions. Some may be of patients and some may be of doctors. So now I want to stress on eye contact. See, maintaining appropriate eye contact when speaking with others helps communication. Because when you face straight into the eyes of the person who is standing opposite you, they feel that you are confident and they will listen to your conversation. So always maintain your eye contact irrespective of position. You should not think that we are higher officials and the paramedical people are lower level officers. So we cannot turn a blind eye to them. Irrespective of your position, always maintain eye contact. And gestures, as I said, see, gestures convey meaning because you can give a handshake, you can wave, thumbs up, and if you are yawning when somebody is talking, it means seems you are disinterested. But when you are using gestures, you have to be mindful of cultural differences. One gesture in one region may convey a different meaning in some other region. So, whenever you are using gestures, always mindful of the cultural differences. Gestures are important. Why I am saying gestures are important? Don't ignore. See, sometimes plan B may be active. So the gestures are important. This is mainly applicable when the people are turning arrogant inside the hospital. You have to pick up the gesture, that is clenching of teeth, arrogant words, and misbehavior. These sort of gestures, we have to take cue. They are important and we should not ignore them. And the gestures are important to reduce the workspace violence. Then comes your body language. See, the body language is playing an important role in communication. So you have to use your body language and your movement of fingers and hands to convey effectively. And you have to read the body language of others also. So again, it is important. From the body language, you can infer that the patient or the attenders are going to pick up quarrel with you. So that is very, very important. So the wrong body language of the attendants have to be noticed at the earliest stage so that the security can be alerted. So what are all the types of body language? I will give you a mnemonic called people. So people means P stands for postures and gestures. I stands for eye contact and O stands for orientation. How you stand, that also gives an important this thing. So then comes the presentation. How you deliver the message. So then comes your L, look. So a doctor should have a good look, comfortable look. We need not go for beauty parlors, but the appearance and the dress code is important, especially when you are communicating. You should be very neatly and comfortably dressed, and you should not be having a shabby look. Then comes the expressions. So these are all the points, mnemonic of people to denote the types of body language. Right. If somebody is talking, that somebody is not listening, what is the reason? Because not listening to the patient, that will give a wrong impression upon the doctor. Patients, that a doctor is not listening to them. So this sort of communication problem will definitely bring down the reputation of the doctor. So any communication barrier should be addressed immediately. So what I want to convey now, see, the barriers in communication is due to speaker or the inattention, poor expression, premature evaluation, emotions and inconsistency will be the problem on the listener side, and the speaker should address the barriers in communication because the doctor should know how to say things differently. It should be in a local parlance, regional language. We may be knowing so much of a scientific subject, but the unwillingness on the part of the doctors to say things differently will definitely be a problem in communication. And we have to learn new approaches also. And the lack of self-confidence and enthusiasm is important whenever you want to give a speech or the routine communication with the patient and the attenders. That voice quality, that is at most important. That is the reason why sometimes if the voice is not heard or if the patient is having a hard of hearing, it will be a problem. So the voice quality should be good. And using a lot of medical jargons, the patient will be bored, the attendants will be bored. So instead of medical jargons, use the regional language to explain. On the receiver side, this is a problem the doctors. The receiver side, the problem may be selective perception and unwillingness to change. Sometimes the patients and attendants, they will be going through Google guidance and they will not listen to the doctors and they will be unwilling to change. And again, the lack of interest in the topic and prejudice, these are all the problems on the part of the receiver. And the internal and external factors will play an important role. So if suppose the air conditioning is not there, then they may be reluctant because of the sweat. So the ambience is also important to receive a communication. So the external barriers will be, which are producing some hampering the communication skills, is environment. So the venue is important for a stage speaker, but when you are talking to the patient and the attenders, the room, the consultation room, that is a venue. So that the environment is to be comfortable and no surrounding noise is to be there. And the temperature in the room should be acceptable. So preferably air conditioning. So the distractions will create always a problem. Suddenly, if suppose the power failure occurs, then the distractions will be there. The distractions may be just like a banana is growing in the monkey's tail, then there will be a problem. So distractions we have to avoid. Then the other people's status and education is to be kept in mind. So you cannot talk in the same tone with the literate and the illiterate person. So you have to adjust accordingly. Then the time, we should not keep on lecturing. Even in the conference, if the time allotted is 30 minutes, if you are talking for 1 hour, everybody will be bored. However good the lecture is, the same thing is applicable for communication with the patient and the attendants also. The time is important. And the easiest way of communication is active listening. Whenever the patient and the attendants talk something, you please listen or act as if you are listening. You have to go for active listening or act as if you are listening. That will help you. This is what the psychiatrists do. They will listen for 45 minutes. They will listen whatever the patient talks. So that will be helpful. So we have to know communication is not only that we are talking, it is also listening the patient and the attendants. So it encourages further discussion and the patients and the attendants will have a psychological satisfaction that the doctor listened to their grievance. So the active listening impresses empathy. So how to improve the listening skills? Don't be preoccupied when the attendants or the patient is talking. Always be open-minded and pay attention and you minimize interruptions. And effective learning is hearing, interpreting and understanding the message. So for that, the mnemonic, the solar I am giving. So sit or stand squarely in relation to the person, that is the patient or the attendant. Always be in an open position. Lean slightly towards the person. That means you are so much interested in listening to them. And again, as I said, maintain eye contact, even if you are talking or you are listening, and always in a relaxed mood, so that the patient and the attendants will also be relaxed. So the effective communication, the mnemonic is pile. First, you prepare what you are going to say to the patient and the attendants. Then you inquire, ask questions, stay alert and check. Then listen actively. So the E for evaluate. So by preparing, by inquiring, by listening, you can evaluate what you have to do in the future. Then how to establish a rapport with the patient and the attendants that is a part of communication skill. To establish rapport, first of all, we need a self-confidence. See, now imagine this macaque monkey is taking a selfie. So that means it is having the self-confidence. So whenever we are seeing the mirror, we should have the self-confidence. So we should understand the people and always we should be enthusiastic and we have to maintain eye contact and we must be interested in listening to the patient and the attenders. Now I want to tell you, this is a statistics. In the total communication process, writing is only 9%, what we prescribe. Then reading is 16%. Even if you give a pamphlet, they will be reading 16%. And what the doctor talks speaking is 30%. But imagine the highest share will be listening, 45%. So if you listen, even if you're not good at words, you be good at ears. So if you listen to the patient and the attendance, half of the battle is won. So in communication, only 7% is words and 38% is paralinguistic. What I mean by paralinguistic? The accent, tone, pitch, quality, voice modulation, everything plays a role. It plays more than the words. And 55% is body language. So always the body language is important. We should be empathetic. And if your body language is good, again, half of the battle will be won in the communication skills. So as the lighter vein, I can tell you, a good communication and a wife brings balance in life. See, now this tire is missing, but the wife balances same way. The communication skill can balance even the problems in the treatment. Actually, a doctor, mainly as I'm an anesthesiologist, there are so many works for the doctors to do. In addition to all their works, communication should be one subject and it should be taught as a subject in the undergraduate level itself so that the doctors can be successful in practice. And avoid distraction while talking to the patients. That is important. Sometimes we will be answering over phone. See, even the mother just delivered the baby, but she is only seeing the phone, not the baby. So this sort of distraction will always lead to depression with the patient and the attendants. So some statistics regarding the communication skills with the physician, the surgeons were satisfied 90%. Majority of the surgeons said we are satisfied, patients are satisfied, so they are happy. But the intensive care physician, the level is only 23%. You can know the difference. See, the surgeons, they will operate and they will leave the scene, and the patients will have some reputation on the part of the surgeon next to God. So they don't ask him more questions. So he is satisfied in 90%. The ICU physician, they will be asking daily, what is the progress? What is the progress? What is the progress? So he will be irritated because he may be standing for hours. But the nurses, only 3% were satisfied. That means nurses are there always with the patient and they have to bear the torture of the questions. We feel that it is a torture, but they have to explain because the nurses are easily approachable. So the communication skills, the nurse's satisfaction is only 3%. So what the family expects from the doctor, we have to know in the communication. Trustworthiness and a truthful communication, that is important. And the family, even though they are non-medical people, they want to have a share in decision making. So you allow them to be a part of decision making or act as if you are allowing them in the decision making process. That is important. And maximum number of empathetic statements they expect. So you please give, whether you are empathetic or not, give maximum number of empathetic statements. That is important. And maximum communication is expected by the family more than the treatment. You may be a good doctor as far as the treatment is concerned, but the family expects only communication. So you please communicate. And I have seen the attendants need more information than patients. They may be related to patients or may not be related to the patient, but they need more information than patients. So we have to oblige them also. So when the patient is bad, when you want to break the bad thing, you please remember the mnemonic as value. Value means you value and appreciate what the family member says because the patient is sick. The patient at any point of time, the patient may die. So the problem makers are only the attendants, family members. So you appreciate the family members and acknowledge the emotion. You please say something bad is going to happen. Of course, it is a sad news for you. then your voice modulation and the tone should communicate the emotion. And at that time, they may be angry, they may be upset. So, but whatever they say, you listen actively and give time for the family. At that time, you have to maintain your coolness. So, understand their points fully, their body language fully, and elicit question if you want to make any other thing. So, in breaking a bad news, the communication, I want you to follow the mnemonic spikes. Spikes means the S stands for settings. So the setting means there should be a private space. What I want to convey, the private space should not be large. It should not be an auditorium where you can accommodate 20 people or 30 people or 40 people. See, the space should accommodate only 4 people, not more than 4 people. So the private space should not be so large. It should not be so small. So it should accommodate only between 2 to 4 people so that it is easy for you to communicate. Then perception. You first assess the understanding of the relatives just by their body language or through your paramedical people assess what sort of a perception they have and you invite them for talk. How much information is desired? Then your knowledge, as I said, you have to explain it in the local language. And again, use as far as possible empathetic statements. And the sequelae, the last S is sequelae. So you agree on the next step when we can meet 30 minutes later or 1 hour later, I will brief you. So this sort of a bad news, breaking bad news, you should prepare yourself first. Then you have to call the family to break the bad news. And why I am saying the venue or the room is important in communication, anyone can help in communication, either the living thing or a non-living thing. See, the why we need to plant more trees because even the trees can help in communication. So that is important. So a good ambience is needed for breaking a bad news. So that is important as far as the bad news declaration is concerned. So when the attendants are angry, workspace violence is now increasing. So when the patient or the attendant is angry, you follow the nurse approach. Nurse means you need not employ a nurse to communicate them, but a nurse is a mnemonic. So the nurse will be name the emotion. First tell them, I think you are angry. Whenever they are shouting at us, you are not supposed to again reciprocate the same. So you say it seems you are angry. So you understand, then respect because you appreciate the caregiver, appreciate the family members. Because I used to say jovially, when the patient is dead, the fees is going to be paid only by the family members. So you appreciate the family members so that they will not pick up a quarrel with you. So then support and you act as if you are supporting them and explore what any other thing, whether the physician can do. Just like if the patient is dead, whether the body could be shifted, whether ambulance could be arranged. So explore what are all the other possible things. So this sort of a nurse approach will reduce the workspace violence. And responding to anger means when a patient is examined by so many doctors in the polyclinics and by specialty wise, when the mob is against the doctor, majority will be behaving in a different way. It is very difficult to control them. So what you sow, we have to reap. So the responding to anger, when the crowd is in an angry mood, don't be defensive. Don't be defensive and don't take it personally. Don't take it personally. You be there, but don't talk till the anger is getting reduced. You allow them to talk because it is a venting mechanism. So you listen respectfully. I want to tell anger is a coping mechanism. In psychiatry, they say once the patient is dead, the family members will shout. But within 1 hour or 2 hour, the tempo will be coming down and they will know the doctor has done the right thing. So for that anger to vanish, we have to wait patiently. So when the patient is in anger, doctor has to be patient. That is the point. but at the same time, set appropriate boundaries for safety. Employee bouncers or inform colleague doctors, police officials, and you have to find a safety place. That is all the more important when there is an angry mob. So when you want to withdraw the support, you have to consider legal consideration, ethical consideration. Again, you have to discuss with the family members. And when the patient is not able to, you cannot make the patient come around from the disease in ICU, discontinue the unnecessary and troublesome monitors. That itself will create some sort of a reputation with the family. So you maintain the communication with the family members. In the advanced care planning, do not resuscitate orders. It varies from place to place. And the DNR orders may create so much of a problem because of changing preference. Sometimes they will say you treat, sometimes they will say you don't treat. So there is an inherent difficulty in predicting future because the circumstances change and the decision made by the surrogate may not indicate the wish of the patient. So in do not resuscitate orders, we have to be careful with that. So repeated discussion with the patient and the attendant is helpful. Now, I want to give a take-home message. So these gas cylinders, they weigh only 17 kg. But the loadmen, they will roll the cylinder or they will employ a cart to bring the cylinder. But at the same time, see, this is a 50 kg weight. But with a lot of smile, they are lifting this. But a 17 kg, they are depressed. Even a female can carry a man with all the smile. What is the big difference between this 17 kg and 50 kg? The 17 kg people, they are depressed. They are not interested in doing the work. So they feel 17 kg is a more weight. But these 50 kg people, either they are paid more or they love their job. So they are easily lifting that. So see, this man with all the smile, he is carrying that 17 kg cylinder. So it means if you involve yourself in a particular job, you will be good at it. So you be involved in communication. So enjoy your work as well as communication. So the carry home message will be either it is a wood or good. The carry home message will be you please love the job of communication. And communication is an art. It is a specialized art. It should be learned by the doctors because nowadays the trend is not like the yesteryears. It is changing and the people are finding fault with the doctors. So you know how to communicate because the patients and the attendants are dancing on the shoulders of the doctors. They want the doctors to oblige for everything and they feel arrogant. They are arrogant. So they blame the doctors. But the magic of communication could turn even foes into friends. So even the monkeys can be trained with a good communication. Human being can be easily tackled with a good communication. So I thank you all for the patient hearing and the Clirnet for giving this wonderful opportunity. I thank you all.
Thank you very much, sir, for your wonderful talk. The presentation which you shared was really very informative as well as lucid. So, sir, we have received few questions from our participating doctors. So, with the permission, may I share my screen with you with the questions, sir?
Yes.
Okay. Thank you very much, sir. I'm sharing the slides with you. You may answer the questions, sir. Okay, sir. I think the question is visible. You may proceed.
Yes. How does communication style differ when dealing with the children, elderly patients, or terminally ill patients? This is a good question because first in a children, what I used to do, see if the children are able to communicate, that is at the age of 3, they will be free to communicate. My mobile will have so many videos and the cartoon. Mainly this Tom and Jerry cartoons will be there. So the games I will show to the children. Thereby they will be attached to us. They will be ready to communicate with us. So these Pokemon are cartoon characters. We should know compulsory. Then only we can talk to the children. Same way your Pokemon or Spider-Man, whatever it is. So you have to talk to the children like that. And the elderly patients, the problem with the elderly patients will be first hard of hearing. And most of the times, the elderly patients will be talkative. So first you allow them to talk. And with the elderly patients, you have to maintain utmost patience. You, whenever needed, you have to write and show to them. And you have to check whether the hearing aid is properly fixed to them or not. And you have to pacify them. And you have to have the empathy towards the elderly patients. The terminally ill patients, I think these are very easy to tackle because terminally ill patients will not talk to you. And most of the time they will be unconscious and they may not be able to comprehend your words. So at the time of terminally ill patients, as I said, you tackle the family. So if you could not tackle the patients, you have to tackle the family because ultimately they are going to decide the future, whether they want to be angry or not. Everything will be decided by your communication skill. So these three differ in the mode of communication. So in terminally ill patients, I think the stress will be on the communication with the family. Next question. Yeah, this is a best point because now I am writing a medical legal article series. 7 articles I have finished, and most of the time the medical legal situations can be avoided by a clear communication. So I can take it in two ways. One is the prevention of medical legal problem with a good communication with the patients and the relatives. Honest communication will reduce the medical legal problems. That is the first point. So you have to be good at communication and explain everything without any bias. So that will help you. And in case if you are sued and if you are going to the court, then the communication you have to maintain. You are not supposed to irritate the lawyer or the judge because whether you are right or wrong, it is going to be decided by the judge third party. So always be polite, and in the court, don't exceed your limit. Don't give a lecture because court is something different. It is not a medical conference. So we are not supposed to elaborate so much. So we have to curtail communication with the help of the lawyer. So that is the reason why I say it is always good to select a lawyer who knows law. It is better to select a lawyer who knows medicine and the law. But it is always the best to select a lawyer who knows the attitude of the judge. So that is the communication part. So the medical legal situations, definitely the medical legal cases will be reduced if you are good at communication. Yeah, this is what I said already explained. The angry, anxious, or non-compliant patients. That is a good question because when there is an angry mob, first of all, you decide your safe place. So you call, if you are having a doctors association in your place, you call them for help to communicate medically. Then you inform the local jurisdictional police station. If you have your friendly lawyers or if you are having a family lawyer, you call him also. And whenever the patient is angry, shouting at you, please don't react. With a bowed head, you wait. You wait for the angry to vanish. But if they are violent, destroying the property, or if you feel that you may be manhandled, first you go to a safe place. And on behalf of you, some other people will talk. Again, when the mob is angry, they will not listen to any statements. So only police people can control them. But as I said, after 2 or 3 hours, their anger will vanish. Anger is a coping mechanism. But till that anger vanishes, we are not supposed to quarrel with the patient. So we are not supposed to give every time a counter statement for the angry mob makes. So you please wait. But when a mob is angry and violent, first you ensure a safe place for you. Then now majority of the corporate hospitals are employing bouncers, but it should not be a manhandling actually. They should be just like a showcase dolls. They should be there because if they manhandle the attenders, the issue may take a different turn. So whenever a mob is angry, non-compliant patients are there, you communicate politely.
Thank you very much, sir, for answering all these inquiries of the participating doctors so well and in so much detail, and also for generously contributing your valuable time and for sharing such valuable insights with the global audience as well as all the Indian audience as well. So, thank you very much, sir, for your valuable time.
Thank you.
Thank you very much to all the delegates for joining us today, and I hope you found this session to be extremely valuable. So, with this, we are concluding the session here for today. But lastly, before ending the live, I would like to request you all to follow us on our Facebook,